I'm Dr. Willie Ong. I'm a cardiologist. For today, I'd like to teach you about high blood pressure or hypertension. High blood pressure occurs in 25% of adults. It can cause heart attacks, strokes, and kidney failure, and we don't want that. Fortunately, hypertension is easy to diagnose and to treat. All you need is a blood pressure apparatus. Have somebody check your blood pressure, or you can also use the electronic type of BP apparatus, which is fairly accurate. So how do you know if you have high blood pressure or not? I have this board here. If your blood pressure is 120 over 80, that's the ideal blood pressure. If your blood pressure is 120 to 139 systolic, the first number, or 80 to 89 diastolic, that means it's a little high and we have to monitor it. And if your blood pressure is more than 140 systolic and 90 diastolic, that means it's quite high and you may have high blood pressure, and we may need to give you medicines and institute lifestyle changes. And if your blood pressure is more than 160 over 100, that means it's very high and you need to see your doctor soon. There are 4 effective lifestyle changes to reduce your blood pressure. Number 1, we have to lower and lessen your salt intake. Exert an effort to lessen your salt intake, and this can lower your blood pressure by around 5 to 10 points. Number 2, if you're overweight, you have to lose weight. If you lose 10 extra pounds, this can lower your blood pressure by 5 to 10 points. So if you're overweight by 20 pounds, you can lower your blood pressure by 10 to 20 points. You have to exercise more. And number 4, you have to eat less meat and more fruits and vegetables. There are 4 medicines that doctors usually give for high blood pressure. They start with the letters A, B, C, and D. A stands for ACE inhibitors such as your captopril. This is the generic kind. Captopril is good for patients with diabetes and heart failure, but in 5% of cases, they may develop cough, so we give them another type of medicine. B stands for beta blockers such as your metoprolol. Beta blockers are good for patients with heart disease, palpitation, or angina. C, we have the calcium antagonists such as your amlodipine. The calcium antagonists are very powerful. It can treat very high blood pressure, but in a few cases, this can lead to leg swelling. And D, we have our diuretics or hydrochlorothiazide, which doctors usually give for elderly patients. So in summary, hypertension is easy to diagnose and to treat with lifestyle changes and medicines like so given by your doctor. And don't worry about these medicines. They're very effective and safe. They can prolong your life by 7 to 10 years according to some studies. So do yourself a favor, get your blood pressure checked today, and I hope you take good care of yourself, for your family, and for you.